of the National Association of Social Workers North Carolina chapter. And I would like to welcome you all to day 3 of North Carolina Social Work Advocacy Week. On this 3rd day of March, we recognize that it is Social Work Month. And this month, we not only celebrate our amazing profession, but we also educate the public and our elected leaders that social workers are and always have been essential. Everyday social workers strengthen the well-being of those who are vulnerable and oppressed. If you all haven't seen our news and social media posts, social workers who meet in person with clients are essential frontline workers and can start getting their COVID vaccine if you haven't already. You can learn more at yourspot.yourshot.nc.gov. If you have questions during the session, whether you are with us right now on Zoom, be sure to enter that into the Q&A, or if you have questions and watching us live on Facebook, feel free to put your questions in the comments. I would like to introduce NASW North Carolina Director of Advocacy Policy and Legislation, Castillo, who is going to introduce our legislators this morning so we can learn a little bit about our social workers who serve in the North Carolina General Assembly. I will let you take it away, Kay.
Thank you, Valerie. Hey, everyone. Thank you so much for joining us today. This is a really great event. We've had a lot of great communication from other lawmakers and social workers serving in different advocacy positions. And today we're going to hear from 2 social workers, one of whom is serving in the North Carolina Senate and one is serving in the North Carolina House. So I'm going to go ahead and introduce both of them and then let them take it away. And Representative Meyer and Senator Batt, whoever wants to go first after intros is fine with us. So Senator Cindy Batt represents Senate District 17, covering Wake County. This is her first term in the North Carolina Senate, but she has previously served a term in the House, filing her first bill in February of 2019 to save clinical social work licensure. For over a decade, she has served as a family law attorney, child welfare advocate, and social worker. She received her JD and MSW from the University of North Carolina at Chapel Hill. And Representative Graig Meyer has served in the North Carolina House of Representatives since 2013. He represents House District 50, serving constituents in Orange and Caswell counties. Prior to becoming a legislator, Representative Meyer served in North Carolina Public Schools for over 16 years and continues to work with schools and youth-serving nonprofits as the co-founder and principal consultant at the Equity Collaborative. Representative Meyer earned his MSW from the University of Chicago. So I'm going to let you all take it away.
Hey, everybody. Go ahead, Senator Batch.
I was going to say that Greg's clearly living his best life because he's outside in the sun for once, and I am clearly in an office getting no sun whatsoever. So someone has made better life choice decisions. It's really great to see you all today. So Greg and I are the social workers that are currently, the only social workers that are currently serving in the General Assembly. And there are lots of challenges to why that's the case, right? Our system is set up with a part-time legislature making very little at $15,000 a year. And so it's really difficult unless you're independently wealthy or retired. And oftentimes, Greg and I serve with people that are both to go ahead and advocate. But there are other ways that we can advocate every single day, and that's what you do for a living. So I had an interesting trajectory into social work and law. When I was younger, I knew that I wanted to be a social worker, and I started talking to lots of social workers, and they'd say, you can't change the system within the system, Sydney. You need to go ahead and become a lawyer. And so I didn't give up on that dream. I was like, well, I'm going to do both. So I went to UNC and got my master's in social work and also law. And I did direct practice because I felt like those skills are going to be extremely important moving forward. And that's what I do every single day, right? In family law and child welfare advocacy. It's interesting because my trajectory the reason why I ended up running for the General Assembly in the first place is that every single day and representing my families in the court system, I knew that there were policies that were harming every family that I represented. And there were so many policies that were not based in evidence in the laws that were actually being passed. And so the only way that I felt we were going to be able to change that and to bring more equity, frankly, into the laws that we pass and that govern so much of our clients' lives is to actually run for office. So in 2018, I decided to run for office. And since that time, we have had our fair share of challenges, regardless of what line you are with regards to partisan values, of trying to get really great policies that will help the underserved and the marginalized communities of many of which we represent. But what I will tell you is that there's hope. Even if we don't have a lever of power, there are certain ways in which we can actually try and actually make laws better, but then also get policies slipped in different places so that we can improve what's going on. I think in this session, even though we still have partisanship and politics is always part of what you have at the General Assembly, there's actually a movement in the child welfare space to really improve a lot of what we're doing with the child welfare laws. And so I'm working with Republicans in the Senate on an omnibus bill specifically to try and improve permanency and other issues with regards to the child welfare space. But that's not just one, that's only one aspect of so many things that Graig and I do in both of our respective chambers in trying to make sure that we're in a position in which people are able to actually get better policies through the work that we do. So you may not see our names on all of the bills, but know that behind the scenes, we're actually doing that advocacy work. And what's really important is that we have a unique perspective because so many of the other people in the General Assembly don't have experience in the social work field. They may not even work with or know people that are marginalized, right? They may be constituents, but if you're a business person, you usually hang out with business people. So it's not necessarily the same experience. But what I do every single day, and Graig with regards to what he does with his consulting and the work that he did in the education space prior to with direct practice, is that we know what people we know people who are suffering every single day. And so we bring a different perspective at the table when we're talking about them. And I think that we've at least earned the respect of some of our colleagues to come to us and say, what's really happening and how will this policy actually affect our constituents. The other thing that I would say is when you guys have the ability to actually advocate, what's important is storytelling, right? And I know that I've talked to some of you about this before, but legislators in the General Assembly do not know necessarily about evidence-based practice. They don't know what that means. They don't know about most of the things that we actually do every single day. And a lot of them will pass legislation or promote it because of anecdotal evidence or stories that they have of a constituent. And an entire area of law can change simply because one senator files a bill with the idea of helping a constituent and it changes that for thousands of people, right? Sometimes hundreds of thousands of people. And so when we're going to actually when you go to talk to legislators, you just need to meet them where they are. And you need to try and figure out where you can actually get your goal met and then try and see the lens in which they're looking through that. I'm working on legislation right now in order with one of the senators in trying to make sure that his goal is to decrease abortions in the state by 50%. And I said a really great way of doing that is to actually increase the funding to long-term, reversible contraceptive devices, right? LARC devices. And so we're working on that bill, right? He sees it, he has a goal, and I have a goal, which is making sure that women can have family planning and we can increase access. So we are still able in a bipartisan fashion to actually look at legislation in a unique way. He looks at it from his lens, I look at it from mine, but we still have the same goal, and then we can get increased funding. So that's just one example of many, and where I think that the unique part of being a social worker is that we issue spot, and then we figure out how we can actually solve that. And by doing so, we can actually see through the lens of somebody else, and we can meet those legislators where they are. And you as social workers can do the exact same thing. You talk to a legislator, you try and figure out exactly where they are, what they're thinking, what their goal is, and then you try and marry that with what your goal is. And sometimes it may just be, you would be surprised, oftentimes about what you will actually promote to them because they really want the same thing. We just have a very different way of getting there. So I encourage you guys to reach out to legislators, not that just are your same political affiliation, but those who actually have the ability and the power to change laws, because that's exactly where we're going to need to work with those individuals, because they have the power to, of course, call a bill in their committee and then also to the Senate and the House floors. So I'll let, of course, Representative Meyer speak, but I just wanted to tell you guys, thank you for everything that you do. It's a great Social Work Month, Women's History Month. It's a fantastic time in March, spring, the weather's out. Graig was, again, living his best life. And so I just want to thank you for everything. I mean, COVID has been a significant challenge for all of us in the social work field. We have tried as much as we can with regards to making sure that the families that are the most hurt still have some safety net. And we have a lot of challenges in the General Assembly, but I do think that we all have a really important role in to make sure that we are holding legislators accountable and actually working with them and bringing solutions to them, because they're not always thinking of the same way that we do. And that's the unique superpower that I think all social workers have. So thank you very much for having me.
Well, it's great to be with you all. And Sydney, you are welcome if you want to leave the legislature to come help me move boxes this week. I'm sitting on the back porch of a new house. And so that's why I'm dressed down, and that's why I'm in the sun. I'm moving houses. But in this week when I'm not going to be at the legislature very much, I did want to make sure that I kept this appointment to join all 200 plus of you here for Social Work Advocacy Day. This is my favorite legislative advocacy gathering of the year. I never miss the opportunity to connect with my fellow social workers. And so I'm just so deeply appreciative of y'all being here and glad I could join you. Senator Batt's advice to you is excellent. I saw the first question that came in the Q&A said, do our colleagues in the legislature even understand what we do as social workers? And the answer to that is no, in part because they haven't spent a lot of time with social workers, as Sydney said, but in part because think of all the things we do. How would you describe all the capabilities of social workers to anybody? We work in so many fields with so many different groups of people. We have so many different approaches to what we do. Whenever I'm talking to young people who are considering going into social work versus counseling versus nursing, whatever it is, I just talk to them about how versatile our field is and how over the course of your career, you can do so many things. And I think that's why it's so easy to be an elected official as a social worker. We're trained to think about individual psychology of who's this person we're working with, like Senator Batt just exemplified with that senator that she's working with, to meet him where he is so that they can find their common interest. We're trained on group dynamics, which you have to navigate the legislature or any elected body. We're trained on systems thinking about how do you actually change what's around us so that it works better for people. And we lead with our code of ethics, as I saw the question from Lynn Walter there. We lead with that belief that we are always here to advocate for those people who are marginalized, vulnerable, oppressed, living in poverty, suffering from systemic racism or other forms of oppression, et cetera. And that our code of ethics calls on us to not just help individuals, but to help work on the systems that impact those individuals. I spent 16 years working in North Carolina's public schools, but I got sick of banging my head against the wall of the same thing again and again and again. I wanted to fix the system, not fix the kids. And so that's why I ran for public office. And I think that whether you want to run for public office or if you want to be someone who wants to just be a great advocate for the things you believe in, your social work skills will lead you well. We have the ability, as Senator Batt said, to figure out where people are, meet them where they are, and move them. And as you go to talk to legislators, just use those social work tools. I'll give you a couple examples that I've used this year in similar cases to what Sydney talked about. I really wanted, my number one legislative priority for this year was going to be pass a bill that Senator Batt and I actually co-sponsored in the last legislative session, which would to create paid family leave for all working North Carolinians. But Democrats didn't win the majority. And so I'm not able to pass that bill just by being in the majority party. And I started to think, like, who are the Republicans who I think might actually have the most interest in this? None of them co-sponsored it with us last year, but who is it? And I thought about one person who I thought about, like, what are her core values? And her core values are family, work, and fairness. And I talked to her and I just started asking her, I said, I've watched you for my whole time in the legislature. It seems to me that, like, I think these are the values that you really represent in your legislative approach. And she was really flattered, said, I agree. I think those are things that, that is what I try and think about. And then I asked her, I said, given those values, how do you look at paid family leave policies? And she said, I've never thought about it much. And so we started a dialogue, opened a door. I don't know if I'm going to be able to get her to sponsor that bill with me or not, but that is my goal for this year, is to get her on board with that important policy that I think would benefit all working North Carolinians and their families. So whatever you're advocating for, you can have a similar conversation with folks. Start with getting to know them. What are their core values? And how are you going to connect what you're interested in to what it is that they care about and believe in? Similar experience this year. I heard that one of our colleagues was working on the intersection of mental health and policing. I happen to be a crisis worker on the Chapel Hill Police Department. for 3 years earlier in my career. And so I went to her and I said, hey, I understand you're working on this issue. It's important to me. It's something that I've done before. Can we talk about it? And so now we're working together on that, because she was working on it from the outside. I'd been on the inside of it. We got the chance to pursue it. You as advocates have so much experience, especially when you think about the voices of your clients or the communities that you advocate for, and how little access that they likely have to the political system and to political power. You are their access when you advocate. That is the calling of our field, to do that. And I'm so glad that you're here and will be part of social work advocacy today and ongoing throughout legislative session, hopefully, to try and make a difference.
Thank you both so much. That was so great. I think having two social workers in office is a really great opportunity, you know, in our opinion, for your colleagues. I often hear from other legislators that we're working with on, you know, well, who do you think would help us with this? And it's like, well, you know, these are the two social workers in office. Last year, we had 3 social workers in office, and they could really, you know, help develop this bill or write something better. And another great example of social workers in office is, I think it was last week in committee, Representative Meyer was debating a bill on summer school opportunities, and very poignantly just said, I'd like to add this amendment about having access for the kids to have access to social emotional, I think the exact language was social emotional
social emotional learning support.
Learning support. There you go. I was trying to, you know, staff, whatever it is, if they participate in summer school this summer, which is a bill going through the legislature right now, and said, you know, if the school districts start thinking about this, if you aren't thinking about this, this is a major problem. And these kids aren't just falling behind in school because of COVID. They really need all kinds of supports. And I don't think anybody threw up their hands against you. And I think, you know, just being able to put that social work touch in bills is really beneficial. So anything you all want to share, it just kind of like, you know, I think in the past we've talked a lot about how macro practice impacts micro practice, and how you all see that from your position in the legislature.
Sure. So, oh, go ahead.
That's right, Sydney, you can.
Okay. I would think, so one example is, I'm staying with the reproductive health idea, right? Is that I know that Wake County Human Services normally runs out of their LARC funding through Title X, usually by April or so. And they have a long list of women who'd still like to have LARC devices, but they run out. I would not know that if I did not have the direct practice of working in that area on a regular basis and with clients in the Medicaid space, right, that actually are in the Medicaid space, but then also clients who just, of course, are in that Medicaid gap, right, the ones that don't have access. And so because I work with those families every single day in the job that actually pays my bills in my law firm, I actually know from a direct practice skill in talking to these clients that I can then take it to the next level of saying, what is the actual problem? And the hang up is we just don't have enough funding. And so I was able to use my direct practice skills to, of course, then extrapolate that to the macro level of how many women in North Carolina in this particular field would have the ability to, of course, have, you know, expanded access to family planning, right? So that is a specific example that we're dealing with right now. And we can ask the state and we can work with the Department of Health and Human Services on those big macro issues so that we can actually effectively change things on the ground level for the clients that we're actually trying to help.
And I always tell, when I talk to social work programs, and if you're separating micro practice from macro practice, like, you're doing it wrong. Like, social work shouldn't separate the two as much as we do. We can't help individual clients without changing the systems that they live in. And we can't work on systems without thinking about the way that the systems change impact individual people, but particularly those who live on the margins. I'm going to use an example of my friend who's on here, Clark Corwin, who is my therapist and has been, I guess you would say, a micro practice practitioner for most of his career. He's worked a lot with clients who living with diabetes. So what does he take from all that he's learned from those clients who are living with diabetes? He shows up here today at Social Work Advocacy Day to talk about the type of support that he's seen those clients, other clients, communities need. I mean, you are in effect doing it right because you're here today. There should be more than 200 of us here today. We have to combine micro and macro.
Thank you so much. And then we had a great question in the chat about how did you guys go from being social workers to getting involved in the legislature?
Well, I called Sydney, and about 100 other people called Sydney and told her to run for office. And then she told us all we were crazy and dropped a few bad words in my face, and then finally did it. And now here she is. Is that a fair version of the story?
That is a very fair story, right? Like, and I think the reason why is because most of us don't ever think about running for office. There are some people, certain politicians, you're like, you were planning this since the 8th grade, right? But then there are the rest of us, right? I mean, Graig and I were not sitting around trying to figure out what our actual trajectory in politics was, because we were too busy trying to actually help people and realize that we lacked the tools that we needed in order to have a positive and effective change for the clients and the communities we represent. So I think for me is a very untraditional way of getting into politics, because it was something that I never expected. My kids were young, they're still young, and I still work a full-time job and I'm a partner at my law firm, right? So it's very hard to juggle those things, and it's possible. And so that's one of the things that we would love to do is to make it so that other people can actually enter into politics. That it currently is not set up like that, right? It's not set up for us, but I do think that we need more than 2 of us, right? Out of 170 seats, we certainly need more than 2 social workers for sure.
And we need social workers on local town boards, on school boards, town council, whatever it is. I mean, at every level of government. It is hard to run for office no matter who you are. I don't think it's harder for social workers than anybody else. I think there is also lots of help out there if you're willing to access it, programs that will train you and support you. And then, because you're kin to us, we're always happy to work with social workers. If you want to talk about running for office, contact either one of us. We'll talk to you about what you can do and how to do it. And then I would say once you're in office and even on the campaign trail, again, as I said earlier, your social work skills will acquit you well. Your ability to communicate with people, to work together across lines of difference, to think about how the big picture and the individual intersect, to combine that micro and macro approach, like all of those things will suit you well when you are out on the campaign trail and when you're in office.
Thank you both so much. We appreciate your voice in the legislature and inspiring social workers to run for office. Hopefully we'll see a lot more social work credentials after legislators' names soon. And but appreciate both of you all. And I think everyone here knows that you all are accessible and speaking up for social workers and working with colleagues to get those social work values and input in legislation as it moves through, sometimes successfully, sometimes not, but having you all definitely makes us feel better that social workers are looking at legislation and trying their hardest to impact it. So thank you both so much for being with us. You're welcome to stay on, understand if you need to get back to moving or into your next meeting. But I want to introduce Victor Armstrong, who's with us here today. He joined the North Carolina Department of Health and Human Services as the director of the Division of Mental Health, Developmental Disabilities, Substance Abuse Services in March of 2020, so about a year on the job now, and right as everything was shutting down. His responsibility and oversight is the public community-based mental health, intellectual and other developmental disabilities, substance use and traumatic brain injury system in the whole state of North Carolina. He has over 30 years of experience in human services and earned his MSW from East Carolina University. And having a social worker in this role is really an extraordinary thing for our state. Obviously, we're biased. We love social workers. We think social workers are very well equipped for this type of work, but I truly mean that his ability as a social worker to problem solve, to reach out to marginalized communities, to make sure we're using appropriate language, really has shown in our COVID efforts and everything going on in the state as it pertains to mental health and behavioral health. So Victor, I'm going to let you take it away.
Thank you so much, and hello to everyone, and happy Social Work Month. I am Victor Armstrong, Director of the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, and I indeed am a social worker. So it is, it's an honor for me to be here with you today, albeit virtually. I would obviously much rather be with you in person, but for obvious reasons, that would be ill-advised. I greatly appreciate the invitation from NASW to be a part of today's event. NASW is very special to me. I get asked often by people why I chose to be a social worker. And I don't know that I have ever really come up with a good answer for that. It is, other than it's something that I evolved into. For me, it was a culmination of a lot of different things. It was being curious about human interaction and psychopathology, but it was also about having a real passion for social justice, and social work seemed to be the natural culmination of those things and the natural evolution of those things. So again, I appreciate the invitation to be here today. NASW is the largest membership organization of professional social workers in the world, with more than 120,000 members, but it's not the strength of our numbers to me that makes NASW and the social work profession great. It's our mission, it's our purpose, it is our belief in the inherent worth of every individual, and our drive and resolve to demonstrate that belief in our actions. And if we don't strive every day to improve the lives of the marginalized communities and the people that we serve through our interventions and our advocacy, we may be clinicians, but we're not social workers, because social workers are made of different stuff. The social work profession originated in volunteer efforts to address the social question of the increasing rate of poverty in an increasingly wealthy economy, and why it seemed that some were able to have and to accumulate while others were not. Now, granted, as social work derived its beginnings from seeking equality for the least of us, we do understand that there was a time when we have not been as adherent as we should have been, and didn't collectively stand up and formally stand up for racial and gender equity as we always should have. And notice I say we, because I too am a social worker. But I believe to this day that should be at the forefront of everything that we do. When I stepped into this role as division director 6 months ago, I took on the role knowing that there were going to be a lot of challenges. And I knew that we would be challenged as a state, and that I would be challenged as a leader, even in the best of times. But I came into this role in the midst of a pandemic. I started on March 30th of 2020. And I came into this role thinking that we probably would shelter in place for about 6 weeks. I didn't know that fully a year later that we would be, as a country and as a state, in the place that we are now. And this is a pandemic that has threatened and challenged an already under-resourced behavioral health system. But having spent 30 years in the behavioral health field, I'm no stranger to challenge, and I'm no stranger to change. In my career, I've worked for 3 different DSS organizations. I've worked for 3 different LME MCOs dating back to the area program days, and I worked for 2 different hospital systems. I've served on behavioral health and human services boards, both locally and nationally. I've spoken nationally and internationally on suicide prevention and raising mental health awareness. I've lobbied legislators and fought for change to bridge gaps and expand resources for those living with behavioral health challenges. But I've never seen us challenged in the ways that we've been challenged over the past 12 months. But through all of my years of working and advocating in the field of social work, while I've done so under a lot of different organizational umbrellas, it's always been as a social worker, because that is what I know. And coming into this role, as Kay pointed out, I think the timing was right for there to be a social worker in this role. North Carolina, like other states, has been in the grips of the COVID-19 pandemic. And it has left many communities and individuals in distress physically, mentally, economically, changing our world in many ways. And what we are experiencing is not just an immediate crisis, but a long-term issue, and care for people who need it that has to be addressed. And in my role as DMH director, I will work, and I will continue to work with organizations like NASW to understand the complex needs of the behavioral health field now and as we go through the coming years together, even in the aftermath of this COVID-19 pandemic. One of the things about this pandemic that is unique is that our approach to it in many ways has been similar to the way that we would approach a storm, any other natural disaster. We have here in North Carolina, we have resources that we stand up for hurricanes. And so we've approached this in many ways as we would the response to a natural disaster. A natural disaster, the difference with this pandemic is that it is with us consistently, and has been with us consistently in different phases for the better part of a year now. And while we now find ourselves at the point of having access to a vaccine, that in no way should underscore the things that people have experienced to this point. So while we are experiencing this, we recognize it is not just an immediate crisis, but it's something that will be with us for some time. The behavioral health challenges brought on by this pandemic are great, causing personal experiences of uncertainty, illness, and the loss of loved ones, in addition to profoundly impacting the social determinants of health, including housing, transportation, access to healthcare, and nutrition. We've all been taxed in ways that we had not been before. I have personally lost family members to the COVID pandemic. I have personally witnessed individuals that I know and care deeply about losing family members during this pandemic. And I've witnessed the impact of the social determinants of health on individuals. We've seen a disproportionate impact on historically marginalized populations. And part of the challenge that we'll have to deal with this pandemic is that where we've already seen and already experienced health disparities in access to care and access to housing and access to food, we'll see those gaps widen as opposed to coming closer together. During the COVID-19 pandemic, we've seen symptoms of depression and anxiety triple. We've also seen a significant increase in opioid overdoses presenting in hospital emergency departments. As a department and as a division, we have attempted to respond to the needs of our families and consumers. Early on, we put processes into place to encourage safety. We talked about the 3 W's, waiting 6 feet apart and washing your hands and wearing a mask in public. We attempted to provide PPE for businesses and supports for individuals who needed to quarantine in isolation. We attempted to provide guidance regarding congregate living. And as we moved into testing, we partnered with communities and stood up testing sites. And now that we're in the vaccine phase, we're continuing to partner with communities, but also listening to the voices of consumers and families. Yesterday, we saw updates to the vaccine prioritization where people with intellectual and other developmental disabilities, including those living with chronic diseases, are now explicitly included in prioritized populations for the COVID-19 vaccine in North Carolina. We saw clarity offered for those who live with severe mental health challenges. And while the true impacts of COVID-19 are yet to be fully understood, we still have to act in the present with a sense of immediacy and humanity. As I mentioned before, we've seen the disproportionate impact on historically marginalized communities. But what we've also seen as a result of the pandemic is we've seen the pandemic impact people that had not historically been able to see themselves on the behavioral health spectrum that now identify as having anxiety or depression. or even experience suicidality. We've seen those people impacted in different ways. In 2020 versus 2019, we saw about an 11.5% increase in calls to our crisis line. We stood up our Hope for NC line so that individuals who needed to talk to someone, whether they were in crisis or whether they were just needing someone to talk to or trying to locate resources, that they'd have a line to call. We set up our Hope for Healers line for individuals who were on the front lines, teachers and first responders and child care providers who needed access to services. We did all these things to try to respond to a pandemic, but also putting these things in place because we recognized that we had a system that was not designed to withstand the impact of the COVID-19 pandemic. As a nation, we've also seen political unrest and civil unrest, and the combination of the pandemic and racial and social justice issues we've experienced have added to the collective trauma that we've all experienced. We understand that trauma is not just an event that took place sometime in the past. It is the imprint left by that experience on our minds, our brains, and our body. This imprint has ongoing consequences for how we as human organisms manage to survive in the present. Trauma that is unchecked thrives in chaos and uncertainty. We've attempted both internally and externally to allow space for conversations, for healing, to talk about the things that we are all going through, realizing that none of us are the same person that we were a year ago because we have added to our lived experience the events that we saw unfolded last summer with the civil unrest following the deaths of Breonna Taylor and Ahmaud Arbery and George Floyd. We've experienced the loss of loved ones during this pandemic. So we are all in a very different place than we were a year ago. And because of much of the uncertainty and the fear that has been brought about by these last several months, we find ourselves in an unprecedented place in how we need to respond and how we need to look going forward and how we deal with the issues that face us in the behavioral health space. And while there's much that we don't know, what we do know is that trauma has an impact and trauma leaves an imprint. So we know that we'll have to focus on the needs of our children and the trauma that children may be facing during this time of uncertainty. But while balancing a pandemic and civil unrest, we've also been in the midst of Medicaid managed care, which is a major undertaking that will impact thousands of consumers of behavioral health, IDD, and substance use services. And while I have the opportunity to talk with consumers on a regular basis, and we have our regular conversations with consumers and stakeholders, and I have the opportunity to talk to many of the state CFACs around and regional CFACs around the state, much of what I hear is a mix of uncertainty. When I talk to people, oftentimes it's difficult for people to call out exactly where some of the angst comes from. But when you look at a point in time where we're undergoing the civil unrest, a pandemic, and we're undertaking Medicaid managed care, we understand why people are feeling the way that they feel now and why anxiety is so high. In order to deal with a lot of that, to take some of the uncertainty out of it, we've done multiple webinars and published multiple policy papers and solicited feedback, had listening sessions. We've had behavioral health subcommittee meetings and brought in folks to talk about our plans and to get feedback. Our state staff have done many outside presentations at conferences and speaking at other venues like Benchmarks and the Mental Health Coalition and NCHA and Pediatric Society. But in doing all these things, we still recognize that there is much work to do to ease the minds of consumers and families who question whether we have a system that can withstand this level of change. So we'll continue to keep those lines of communication open. But one of the things that is also not lost on me is that the COVID pandemic and the secondary impacts of the pandemic, such as the effects on food and housing and economic security, have had a disproportionate impact on historically marginalized communities, the Black community, the Latinx community, Indigenous communities. And so I think that one of the challenges that we have going forward is while we're looking at all of the things that we need to do to respond to the pandemic and all the things we need to do to shore up our behavioral health system, we need to have an eye toward equity. We need to focus on reducing health disparities. It is written in the preamble to the Social Work Code of Ethics that social workers promote social justice and social change with and on behalf of clients. That social workers are sensitive to cultural and ethnic diversity and strive to end discrimination, oppression, poverty, and other forms of social justice. And those forms of social justice, the poverty and the health disparities, impact us in many ways. And one of the things that I also want to clarify is that when I talk about historically marginalized populations, and one of the things that I often share here in the department is that when I think of historically marginalized populations, I do consider the behavioral health community to be a historically marginalized population. I believe that people who live with mental health challenges have been discriminated against in a way that no other subset of the population has. And when we talk about historically marginalized populations, or we talk about gender issues, we recognize that there's intersectionality and there's crossover where we talk about veterans. There are veterans that experience issues as veterans, but there are also veterans who are not only veterans, but they're Black veterans, they're LGBTQ veterans. So we understand that intersectionality, and we know that we have to advocate for all of those individuals. And we know that we have much work to do. Recently, Mental Health America released the State of Mental Health in America, and they looked at criteria across all 50 states and the District of Columbia. Their goal being to provide a snapshot of mental health status among youth and adults for policy, program planning, for analysis and evaluation. They were tracking the changes in prevalence of mental health issues and access to mental health care across the different states, and trying to understand how the changes in the national data reflect the impact of legislation and politics. And so how the things that we're doing and deciding to do and the priorities that we're taking on, how are they impacting the delivery of behavioral health resources? They ask questions like, how many adults and youth have mental health issues in the different states? How many adults and youth have substance use issues? How many have access to insurance? How many have access to adequate insurance? How many have access to mental health care? And which states have higher barriers to accessing mental health care? Overall, North Carolina ranked 41 out of 50. We ranked 35th for adult services and 45th for youth services. So we have a great deal of work to do. In terms of access to care, which measures access to insurance, access to treatment, the quality and cost of insurance, access to special education, and mental health workforce ability, we ranked 45th. So clearly it's time for Medicaid expansion, but there is also very clear that we have a great deal of work to do, and much of that work involves rethinking the delivery of our behavioral health system and our behavioral health services. There are three major areas that I came into this role focusing on and feeling that we needed to strengthen. One was in our response in crisis services. Two was our array of children's services. And the third one was really in addressing access, addressing the historical barriers to access and healthcare disparities. Now then also taking into account that we're doing all of those things with the backdrop of a pandemic and rolling out Medicaid managed care. But I also believe that in all of those things, we need to also have a lens toward equity. We need equity in our crisis response system. And I would start with that equity in looking at how we can do that differently by looking at how we design our response to people who are experiencing a mental health emergency. First of all, and I've shared this with folks across the state and some folks across the country in conversations I've been in, and that is that I believe the construct of how we as a nation respond to people experiencing mental health emergencies is flawed. First of all, I have an issue with the fact that when someone is having a medical emergency, we call it an emergency. When someone is having a mental health emergency, we call it a crisis. It brings to mind two very different things. First of all, I don't know that when the individual having a mental health emergency is experiencing that, is it that individual that's in crisis, or is it the system that's in crisis? I had a freak accident some weeks ago, and I cut my arm, and I had to go to urgent care to get it stitched up. I walked in, I was bleeding, and so for me it was a crisis, and I couldn't stop the bleeding. But when I walked in, they were calm. They asked me what I needed. They took some minimal information. They took me to the back. They stitched me up. They gave me a time to come back. It was routine for them. They didn't panic. When someone goes into a mental health emergency, the system panics because we don't know how to respond to an individual in a mental health emergency. So we respond the only way we know how, and that is with a law enforcement presence. And while our law enforcement officers do an admirable job in protecting and serving, the challenge I have with the way that we respond to folks having a mental health crisis is that when someone has a medical emergency, first responders respond with the purpose being to protect and nurture that person. Too often for people experiencing a mental health emergency, first responders respond to protect the rest of us from that person who's having the mental health emergency. And that's flawed. The Department of Health and Human Services and Division of Mental Health recently received a grant from the National Suicide Prevention Lifeline for a 988 state planning grant through Vibrant Emotional Health and the nonprofit administrator of the National Suicide Prevention Lifeline. And the grant totaled $129,555. And it will provide support to begin implementing the Lifeline's new 988 number. So in July of 2022, we will have access to a 988 three-digit number. It gives us an opportunity to rethink how we provide services for people experiencing a mental health emergency and how we can build that without there being a law enforcement response. In July 2022, 988 will become the national three-digit dialing code of the National Suicide Prevention Lifeline, replacing the current 1-800-273-8255 number. In 2019, more than 1,300 people died by suicide right here in North Carolina. So we need to have access to resources. I'm a firm believer that we need to focus on how we get upstream. We look at the number of people that we are losing to suicide, and we anticipate that we will see an increase in suicides in the future. While we hope that's not the case, we know that we have created the perfect storm in the increase in anxiety, and the increase in depression, the increase in unemployment. And while final data for 2020 is not yet available, more than 37,000 callers received crisis intervention and were connected to community mental health resources to prevent suicide deaths through North Carolina's call center for the National Suicide Prevention Lifeline in 2020. That is an 11.5% increase over 2019. And that's with calls received from all 100 counties. But I believe that part of our opportunity is to figure out not just how to respond to people in crisis or people who may be experiencing suicidal thoughts, but it's also to think about how do we begin to put resources in communities where people live so they don't get to that point of experiencing those suicidal thoughts. This 988 opportunity represents a long past due opportunity to shift from a law enforcement and justice system response to one of immediately connecting to care for individuals in suicidal, mental health, or substance use crisis. The 988 Planning Grant offers North Carolina tangible funding for first steps toward implementing a system in which 988 calls will be answered by qualified suicide lifeline affiliates and connected to community-based crisis services where needed. The funding can be used to evaluate our current system and the capacity to meet the projected demand for 988 related services, and it also will allow us to create a roadmap to fill any assessed system community gaps and solidify a crisis system to deliver focused crisis resources for those in need. And this also represents an opportunity to make a fundamental shift in how people in crisis are engaged in communities. So we look forward to the work to come, and we will be engaging in community conversation as we seek to build a better and more responsive behavioral health emergency system. One of my other priorities, as I mentioned, was to look at children's services. And one of the things that we have to do in our children's services is, again, we have to look at equity. Right now, many children with high intensity behavioral health needs, particularly latency and adolescent foster care youth, languish in clinically inappropriate settings, such as emergency department beds or DSS offices for days or weeks while they wait for a residential treatment spot. There are a couple of problems with this. One is that we clearly don't have a system built to meet the needs of these children. Number two, we don't have the resources and processes in place to keep children from getting to that point of needing these resources. And number three, too often our response to children in crisis is to place them in congregate settings. There are numerous systemic and process issues that drive or exacerbate this issue, including a lack of an adequate network of providers who can manage children who are exhibiting violent, aggressive, or sexually inappropriate or other behaviors that are classified as serious emotional disturbed behaviors. We don't have enough providers in our system who can work with children who are experiencing complex trauma. And we are seeing more and more children come to us today experiencing complex trauma. In addition, children with comorbid behavioral health IDD needs have presented unique challenges to place them in appropriate treatment environments. And so we need to rethink all those things. And so we at the department, at the division, we are working with our partners at Medicaid and DSS to look at building a better system. We've built a response system so that we can immediately look at cases where these children are stuck in EDs or in behavioral health in DSS offices, but also looking at how do we build a better system, because we owe that to the families and children that we represent in this state. And finally, I'd say, in addition to those children, we need to look at equity for individuals, all individuals living with disabilities. For the 1 in 5 Americans living with a disability, the health and economic risks that are attached to the COVID-19 pandemic magnify many challenges they already face. We have to continually think of the needs of individuals, including those living with IDD, through the prism of what they are experiencing and what we are all experiencing today. The delivery of services to those living with intellectual and developmental disabilities is about social justice and human rights. It is about equity. It is about the great struggle that the heroes of the ADA fought for. And today, we need to unite like never before to embrace the equity and inclusion of all. And we acknowledge how much work lies ahead. We have made progress. Even in the 12 months that I've been here, we have made progress. We've stood up the different crisis lines. We've developed our behavioral toolkit, which we were able to publish and get out. We've continued to fight for access to care for the individuals that we serve and to have a voice at the table for those living with mental health challenges as we're looking at how we respond to this COVID pandemic. But we still need to unite like we never have before and to embrace equity and inclusion of all and for all. And we acknowledge how much work lies ahead. We have made progress, yet too many people living with mental health, developmental disabilities, or substance use disorders are stigmatized. They're underemployed. They lack access to services and tools that facilitate inclusion in our society. They are still denied the promises of life, liberty, and the pursuit of happiness. And we as a society, and we as social workers, have to fight to change that. There is work for all of us, advocates and allies, policymakers and service providers. We must continue to stand our ground and fight the good fight. And I have no doubt that we will, because we are, after all, social workers. Thank you.
Thank you so much, Victor. As you all can see, this is exactly why we have him as our division director. He laid it out so well, and thank you so much for all you all are doing for including the voices that are often overlooked, especially not just in COVID, but in general. We've had a few questions. I was wondering if real quick you could touch base on,
Sure.
on how folks, students, longtime social workers might get involved in advocacy efforts and advocating for the work you all are doing?
You know, that's a great question. And I get asked that question often. And I think sometimes, at least through my lens, I think people make it more difficult than it has to be. I think you can advocate where you are. For one thing, I encourage people also to advocate one-on-one. You know, you don't have to have an audience to advocate. I advocate oftentimes for people living with mental health challenges, or advocate for the LGBTQ community as an ally. In one-on-one conversations I have with people who may say things that are inappropriate. I advocate for racial equality and equity in conversations one-on-one. But I also think that, you know, there are some practical ways that you can get involved in things. There are always in your local commissioners, they're always looking for people to serve on different boards and commissions. So you can check in your local county and find where there are commissions that you can get involved in. There are always organizations like NAMI and like Mental Health America and like NASW who have different things going on that you can get involved. You can get involved in a walk. You can chair a walk. You know, I serve now on several boards. I serve on the board for the American Association of Suicidology and American Foundation for Suicide Prevention. But like a lot of people, there was a time when I was looking for something to do, something to get involved in. And when I started volunteering at some of those organizations, I later ended up becoming a more of a voice for those organizations and serving on the board of those organizations. But, you know, I think that for people who want to be involved and want to advocate, one of the things that I hope you took away from what I shared today is that the need is great. There are always opportunities to speak up and to advocate and to get involved. Even when we have our consumer stakeholder calls, or we have, the calls with CFAC, those are people who are getting involved and speaking up for folks that live with challenges, and being the voice for people who often their voices are not being heard. So there are always opportunities to get involved in many different capacities and many different levels.
Thank you so much, Victor. We appreciate your time and your willingness to serve in this role. At first you said 6 months, and I said, no, it's been longer than 6 months. You've been in this role for a full year.
That's 6 months.
Originally you did, and you've been in this role for a full year, and we're so grateful that you took this role and stuck with it. And we are so grateful that a social worker is in this role. And I'm so glad that so many people were able to hear what you just said, because this is why we need a social worker in this role. So thank you so much for your leadership. We're so grateful to have you.
Thank you.
So thank you. So I am going to thank Kay Castillo for also facilitating our conversations with Representative Meyer and Senator Batt earlier. And I just wanted to also remind everyone that if you haven't already, please make an appointment with your legislator. Several questions came in about what it is that NASW North Carolina does to lobby on behalf of the profession. So Kay Castillo is our lead lobbyist, and I'm also a registered lobbyist. However, there's only so much we can do. We really rely on you all as social workers and students to meet with your legislators and tell them what it is that you do. Tell them how you serve your communities, and tell them the needs of the client populations within your communities. So it is critical that even if you can't make an appointment with them this week, that you meet with them not only during the session, but often. Build those relationships with your legislators so they know what it is that social workers do and how critical we are to the communities. So, and I also, again, want to articulate that Kay is the only full-time lobbyist at the in the state of North Carolina to advocate on behalf of the entire social work profession. And without our NASW members, that would not be possible. So I thank the members of NASW North Carolina. If you're not a member of NASW, please join us. We are happy to answer any questions. And if you haven't taken a look at our legislative agenda or taken a look at the video for our legislative agenda, that's all on our website. Be sure to sign up for our advocacy alerts. We are here. We are working hard on behalf of the social work profession in North Carolina, but we need your voice. So again, thank you to all of our speakers that we had this week. There are so many amazing advocates in North Carolina, and we're so lucky to have the social work profession. So thank you all so much for being social workers, and we look forward to continue this fight with you. Thank you all so much.